Welcome back. We have Dr. Preety Desai joining us today. She is a laser implant periodontal specialist. That's quite a title.
It is. It's a mouthful.
Yeah, good to have you back.
Thank you.
We're talking today about the correlation between good dental health and aging and how your overall physical health is very directly tied to your good dental health. And to take it one step further, cancers can be increased a lot by having bad dental health as well.
Exactly. You know, September is men's awareness, men's oral health awareness, but men and women are equally at risk. And particularly focusing on men, the cancer incidence of colorectal cancer is #1 for men, and it's directly correlated that if one has a diagnosis of periodontal disease, they will have a higher risk of a cancer.
Do you think many of your clients are aware of that?
I think more and more. My job as a clinician and a specialist is to educate. I mean, that's the Latin terminology of what doctor actually means is teacher. So, you know, you try your best, and sometimes it takes a number of times for us to, you know, kind of get it into our DNA that we understand that.
Right. And then when it comes to aging and aging well, taking care of your teeth and your gums is very important. A statistic here says periodontal disease rates shoot up about to 70% among people who are 70 years of age and older.
That's correct.
That's huge.
It is, and it's kind of scary because as we mature in life, and if you have had a job and dental insurance, you were kind of on a routine of taking care of yourself, but as one retires, they lose a lot of the benefits of dental insurance, so they tend to pull back on dental care, unfortunately.
And so the important message is to try and go even when you don't have that plan.
Exactly, and really a regular dental checkup with a cleaning is the best bang for your buck.
Okay. Now we're going to take a look at some pictures. The first one shows the stages of periodontal disease.
Yeah. So it's just a cartoon. I didn't want to bring in too much red into the photo. But from 1 to 4, the area between the teeth is the bone. And as infection increases in the mouth with bacteria, the bone decreases. So that's where the terminology long in the tooth came, is that the tooth actually looks bigger.
Interesting.
Yeah.
Okay, let's see the next one.
And this is just a more of a detailed caricature of how the bone can reduce in 3 dimensions, not just, you know, in a 2D photo.
Okay, now we're going to get into the nitty-gritty pictures.
So this is
long in the tooth.
This is long in the tooth, exactly. So over time, what happens is that the bacteria not only sit at the side of the tooth, but they work their way down in between the teeth. They reduce the bone, and the gum was next to the bone, and that's their partnership, and the gum says, oh, where's the bone? And it too starts to shrink away.
And that's a huge problem.
Correct. And similarly here, with the risk of recession and receding gums, you can get a higher risk of cavity, like on the lower left, or root recession and sensitivity on the upper right there.
Okay.
And there's treatments for all of this, of course, with surgical and non-surgical intervention.
Okay, and what's going on here? Is one of the parts of the tooth chipped off?
That's right. Someone has lost their front tooth because of periodontal disease, and in order to support the adjacent teeth, this is just a temporary measure, you can actually glue the teeth together with white bonding material and create some support. But this is the last leg. These other adjacent teeth now are overloaded. This is what bridges do. They overload the adjacent teeth.
Okay.
And longevity of bridges is not great either.
Okay.
And this is somebody who has active gum disease, and don't mean to be too gruesome, but that middle tooth, you can see a wet color of white around it, and that's pus.
Really?
Yeah, and so it is a silent disease. This patient doesn't feel anything, and this pus will then be swallowed or inhaled, make its way into the bloodstream, and cause all the inflammatory changes that the research has proven is detrimental.
And this is right over the lunch hour we're doing this.
Yes.
I think this might be the final picture.
And this is just the actual look of what tartar looks like underneath the gum line, that little blip you can see, and that is what causes all the damage.
Okay, maybe we can briefly speak to the fact that a lot of this bacteria can end up in the bloodstream, and how bad is that for somebody?
That's called bacteremia. And bacteremia causes systemic inflammatory response. And in health now, we want to decrease that with all our antioxidants, et cetera. But part of the anti-inflammatory or the inflammatory response is the diseases that it can exacerbate, like diabetes, heart disease, cancer.
So the message of the day is continue on with those every 6-month checkups, no matter what your age. It's almost more important as you age to continue that regularity.
Exactly.
Yeah.
It's vital.
Okay, Dr. Desai, thank you again for being here today.
Thank you, Susan.
You're very welcome. Information is on the screen if you would like to learn more. KamloopsPeriodontist.com as well, the phone number if you'd like to have some questions answered. We're back with the weather in 2 minutes. Stay with us.